Just to start by thanking actually Tracy and Tess for inviting me to speak today, but also to actually become involved in the Outcomes Evaluation group, because I found it a very, very positive experience, and I think it was a really mutually beneficial relationship that we had. But what I've been actually asked just to reflect on this piece today, and what I'm drawing on is my involvement with the framework from the court work, my involvement with the Children's Services Committees, and then this viewpoint piece work as well. And I when I was thinking about this, there were 5 things that I'm going to talk about this morning. 2 of them are about broader context issues, and 3 of them actually relate to the actual tool itself and part of the process of the tool. And the first one, and although we're actually here today to talk about outcomes measures, I think one of the things that I've learned from the work that I've been doing in relation to outcomes over the last probably 8 years is that outcomes is actually an ethos, and it's a process, and it's a long-term commitment. And even though we do end up with measures and we can evaluate things and so on, it really very much is an attitude and an ethos. And as Tess was saying earlier, the ISPCC started this back in 2007, and we're now in 2013, and we have a tool. But the other thing to say, at a recent national CSE event, Maurice Leeson, who has a very complicated title, which is Children's Service Planning Professional Advisor. He's from Northern Ireland, and one of the points he made was that it's actually been a 10-year journey for them, and it's only really now that they're beginning to realise and see the benefit of outcomes-based planning and actually looking at outcomes and having that outcomes focus. And I think one of the things, being involved in Children's Services Committees, one of the things that I find about Children's Services Committees is actually, although they're said to be outcomes focused, it's very much more of the emphasis has been put on interagency working. And one of the things that struck me both with working with the ISPCC and also doing the work on the court project is that, and the Northern Ireland work, is that in some ways the ISPCC and other voluntary and community agencies are expected to have much higher standards in terms of proving what they can achieve with their services, much more so, say, at the moment than statutory services. And the other thing that struck me is that in Northern Ireland, their outcomes-based planning is based, there's a statutory basis to it. Now, they work voluntarily together, but there is actually a statutory basis to their planning. And I do think that there is a question around, in order to actually be really outcomes-based focused and to really move in that direction, do we actually need a kind of statutory or contractual element to the process? Because I think one of the things that has struck me about is the commitment that was put into this. There was a real commitment to actually following through and working their way through and coming out with an outcome tool. So that's one of the things that really strikes me about this kind of work. It is a real commitment, and although I think there is a risk that we kind of think there are tools out there and all we have to do is pick a tool and then we can go and measure, whereas really what a big part of the process is actually working out what it is we do, why we do it, and then finding the tool that suits us so we can actually measure what we're doing. And the other reason what I find about it, and it's some of the things that Dr. Buckley touched on in relation to her talk, one of the things that appeals to me about the outcomes-based focus is it does throw up some of the power differentials, because when you start to focus on outcomes and what we're doing, it highlights some of the issues that also Dr. Buckley talks about, kind of the context of class and race and religion that can come into the cases that we work with children. And at his presentation to the Children's Service Committee event, Maurice Leeson pointed out that the most persistent problems associated with deprivation and social exclusion cannot be adequately addressed by either individual services or actually even services working in isolation. And to me, one of the beauties of being outcomes focused is actually it starts to put a light on these kind of issues, and it makes it less about kind of the individual parent or the individual child, and it actually brings in the context of our society and how that impacts on both what we can achieve with children and families, but also where the problems are actually coming from sometimes in the first place. So to me, again, that kind of goes back to why I think outcomes is really an ethos and a focus in relation to moving forward in terms of achieving a real improvement in relation to the lives of children. Okay. Excuse me. So that kind of, to me, that's a broader context piece, and it's something that needs to always be kept in mind when you're actually trying to work with outcomes and move outcomes on. And I think working with a much larger organisation such as Children and Family Services, which is the HSE, moving into the Child and Family Agency, I think there are greater challenges in relation to this, and how we actually get to be very outcomes focused. And one of the, I'm going to talk about 3 strengths that I would have identified in relation to the tool. And one of those ones is actually the ability the ISPCC had to bring together all its management levels, the different management levels of its organisation together to actually work on the tool. And as someone working in a much bigger organisation, I think that's a much harder challenge for us. But to me, it was a real strength to the way they approached putting together the outcomes tool. And kind of some of the advantages that I found in that process is that the ability to make decisions, kind of everyone in the room, that they had actually people in the room who could make the decisions and they could move quite quickly on decisions. I think it also added to the ownership throughout the whole organisation in relation to becoming outcomes focused and actually incorporating the tool into the work that they were doing. I think also it was really beneficial in terms of the feedback that they could receive, and so that everyone was hearing the feedback on all the different levels. And I think that was a real advantage. And also I think that the fact that they could have all their management working on this piece at the different levels, it was there was kind of the continual progress then, and there was constant progression in the work that they were doing. And someone kind of working, I do when I kind of, and I suppose to me this is one of the beauties of working on this piece, is that I'm reflecting on how you can actually do that in a much larger organisation. And I don't have the answer to that, but I think it is a real challenge that we would have as statutory organisations to actually move forward in terms of kind of becoming so outcomes focused. So that was one of the kind of the strengths of the approach that I found in relation to the ISPCC. The second one, and this is probably my personal favourite, was actually the level of needs analysis that's actually included in the tool. I think that was a real strength, because as someone, I would spend a lot of time doing what I would consider just getting to do very basic analysis of information. But what they have in the tool here is that the basic analysis is actually carried out. And when Niall did a workshop for us at one point, the level of information that was already gathered within the tool that allowed you then to move on to kind of a more sophisticated level of analysis, that would allow you to kind of look at things around like patterns across programs, patterns across regions, but also patterns kind of within the young people themselves. And I think the fact that that's already incorporated into the tool is a real strength, and it would be something that I would recommend when you're actually looking for an outcomes measure or tool, is that as much as possible have some of the analysis already included, because it frees you up to move on. And I think one of the problems we encounter is that we are always gathering data, but we have such a large quantity, we never really move beyond just the most basic analysis. And I think that was, to me, was a real strength of the tool, is that you have the basic analysis done by the tool, and then you move on to actually understanding and interpreting the information that you have. I think also the other thing that struck me about including the analysis in the tool is I think it was a real selling point for the staff, because kind of some of the comments that we would have heard was that actually staff were able to use it in terms of producing their reports and so on and so forth. And I think that's a real selling point. I think if you have something that works and that staff see as a benefit, rather than just another add-on piece of work that they have to do that they don't necessarily see any impact on in relation to their own work, I think that really is a real strength in relation to using that kind of a measure. The third strength of the tool that I found was that the fact that it's actually online. What really appealed to me about that was that it actually offers the opportunity for all service users to actually respond. So, and kind of picking up on what Dr. Buckley was saying, is that kind of like quite often we end up only talking to the most articulate, and we don't kind of necessarily get to the more problematic service users, to use that kind of phrase. I think one of the real advantages of the online approach is that it does offer you the opportunity to reach everybody. So, and again, working with such a large organisation where we have such a large number of children in care, that really appeals to me, because at the moment kind of we're reduced to using forums. I mean, and obviously these are good things, but I think it adds another kind of bow in being able to actually use something like this. So that again, that was another real appealed to me in relation to this actual tool. And I suppose kind of the example that I had, and I would have actually quite liked to have probably been involved with this before, is kind of like the idea that kind of we are obliged to do exit interviews with children leaving care as a recommendation from the Ryan report. And it really struck me that this is actually could be a very nice way of actually carrying this piece of work out. So again, kind of I suppose for me that was part of the learning process that I got from this, is that kind of the way we could actually apply it in different areas and the benefits that we could have in terms of using it, a tool in this way. The kind of final point that I really want to talk about is, and this is around collaboration and sharing of information, and around sharing tools, and but it also links into the idea of commissioning services and also the business model that we touched upon earlier. Again, I mean, I found I thought we had a very mutually beneficial relationship and a working experience here. And kind of the other thing that kind of strikes me is that the area of outcomes it's ever expanding. It's very hard to keep up to date on all the developments that are there, because we're moving on to, in certain jurisdictions, it's now about effect size. It's not just about what your outcome measure is, it's about your effect size. And I think the opportunities for collaboration and working together in these ways, and having seminars and workshops like today where we talk about the measures and tools like that, are very important. And I think one of the challenges that I think we need to consider is as we move into commissioning services, there is a risk that we create an environment, perhaps unintentionally, where we actually don't share as much as we might do, as we kind of potentially move into what I would kind of term a commercial and confidence environment, because obviously if people feel that they're in competition, then they may be less likely to share or want to collaborate in this way, because there is a risk that someone will steal their tool and then they'll do better when we're commissioning. And I think it is a real risk in the sense of, because one of the first pieces of work I would have actually worked on was it was the privatisation. It was of the first prison in what was then the United Kingdom, and that was a real. Now, obviously, it's slightly different because it is around privatisation, but there is that sense of that once you go into this place where we are competing, sharing of information become much more challenging. So I think I suppose what the reason I raise it now is that so we go into that kind of era with that in mind, so that we don't shut down the opportunity to share and learn from each other and move on and help improve the outcomes of children and also the lives of children. I think what struck me, the other thing I think that struck me as a thing that we need to consider is in relation to the evidence that we use. Because what's the appeal of the online questionnaire is really good. What struck me is that it doesn't allow you to see when a child actually lights up when they're talking about their worker, and I think kind of Helen kind of would have mentioned some of these things as well. But even in my own work, when I've been interviewing young people, to actually see how alive a child can come when they're talking about the service that they received of the person. This kind of tool doesn't capture it, so I think we need to be also very careful about keeping an open mind about what we determine is evidence and what we call evidence is. And again, Maurice Leeson from the Northern Ireland would have actually made that comment himself. He would have said that the Strategic Partnership in Northern Ireland has actually accepted the definition of what counts as credible evidence as widely as possible. And again, for me also, like if you think about, say, children in residential care, once you can get feedback from children about residential care, really if you don't go into a unit and actually experience the unit, you won't necessarily capture the qualitative nature or the kind of quality of environment that you're in. So I think these tools are really important and very beneficial. We also have to keep in mind that there are other information that we can, and Tess herself kind of talked about observation. I think observation is actually a very powerful tool in terms of actually looking at the experiences of children and young people as well. I think the final point that I would like to make is considering, I suppose for me it's about kind of the limitations of a business model within basically what is the provision of human services, because whilst I think there are advantages and there is a need for value for money, it doesn't necessarily follow that we actually have to use a business model. There are many ways in which we can ensure value for money and so on and so forth. And I think also kind of Dr. Buckley mentioned this herself, like we use the phrases like clients and consumers, when in reality that's not the kind of service that we're actually providing, and kind of children and young people would get very little choice in terms of the social worker they have. If they don't like their social worker, they don't get to say, well, I'd like to try and have another one, please. So I think that we need to be very cognizant of the limitations to the business model approach. because I suppose the way I would always look at it is that we provide services to people through people, and therefore so the business model isn't necessarily the best fit always when we're actually looking at how we work with people. And I'd like to end on that point, I think. So thank you very much. I see with me there's a benefit of being quick. I'd like to now invite Janice Wedlock up, who's the child support worker in Monaghan and a member of the Outcome Working Group.